It appears the waiting room is being emptied and folks are joining. So my name is Alan Bentrup, and on behalf of the SEAT Planning Committee, wanted to welcome you to workshop 4, I think we're at right now. So we'll get into the conversation in just a minute. This conversation, folks will introduce themselves shortly, but this is Strategic Conversations the next 12 months, responding to change driving topics. Will be moderated by Karen Kraserick, who Karen serves as the Chief Administrative Officer and Minister for Stewardship at Christ Church Cathedral in Houston, Texas. I'll turn it over to her in just a minute, but I invite you all joining us. If you have questions along the way for any of the panelists, to put those in the chat box. Karen and myself will be moderating those, and we'll try to get to those as they come about. If you have any technical problems, you can put those in the chat as well, and I will try to help you or get you in touch with someone who can help. So again, welcome to our workshop time, and now I turn it over to Karen.
Thanks, Alan. Welcome everyone today. We're here with a really exciting conversation to talk about change driving topics in the church and how the church can react and lead in trying times. Before I let the panelists introduce themselves, I just want to say thank you to the Reverend Angela Shepherd. She had agreed to moderate this conversation for us, but some things came up rendering that impossible. But I want to thank her for the time that she gave in development of this conversation, and just her words and her heart in this conversation will be felt in today. So thanks to Angela. And then Luke, if you don't mind introducing yourself first, I'd like to invite you to do so.
Sure. It's great to be with you all. My name is Luke Goebel. I am the Vice President for Academic Affairs and Dean of Faculty at Warner Pacific University, which is a small faith-based liberal arts university right in the city of Portland, Oregon. Prior to that, I worked as Chief Innovation Officer, and then I've been a faculty member for 14 years, teaching on issues related to race, religion, politics, and world history. So I think I bring a little bit of both of those pieces to the conversation.
That's great. Thank you, Luke. Dr. Boom, Mark Boom, if you wouldn't mind introducing yourself, please.
Absolutely. Well, welcome everybody, and it's good to see you, and thank you for having me as part of this panel. I'm Mark Boom. I'm the President and Chief Executive Officer of Houston Methodist. Houston Methodist is a 8-hospital system in the Texas Medical Center and greater Houston area. We are a faith-based institution, part of the Texas Annual Conference of the United Methodist Church, and have been, as you can imagine, right at the front lines of everything going on this past year. So I'm happy to be here and discuss our experiences with you.
Thank you, Mark. All right, Chuck, if you don't mind introducing yourself, please.
Absolutely. Thank you, Karen. I'm Chuck Robertson. It is wonderful to be here with both Mark and Luke in this time as we look forward and look at what this is going to be like. I serve as canon to the presiding bishop of the Episcopal Church, looking at ministry beyond ourselves. I also have the privilege of being a distinguished visiting professor at General Theological Seminary, and look forward to hearing some of Luke's thoughts on education in the midst of all of this. It is great to be with all of you, and grateful for all of you who are attending different parts of this annual virtual SEAT conference.
Great, thank you, Chuck. So the sort of layout for our workshop today is we've developed a few questions to ask of the panelists. I'm going to ask the first question and then give each panelist an opportunity to respond to the question. Definitely, as the panelists are speaking, please put any questions you have in the chat. We can either address them once the speaker concludes or after we've heard from all 3 panelists. Know that it's important for from the planning committee standpoint that we want people to be able to take away a tangible practice or principle to potentially implement at their parish. For our first question, many viewed both consciously and subconsciously the end of the 2020 calendar year as the light at the end of the tunnel, which thus far it has not proven to be. Anxiety has been at an unprecedented level for over 12 months, and every city, county, and state finds themselves in a different place. we recognize and acknowledge we are not past everything yet, but that we are also in the process of moving on to the next thing, which is still hard, but in a different way. How can we help to manage this anxiety? And how can we inject hope into the time ahead? So Chuck, I'm going to ask for you to maybe take a stab at answering that question for us first.
Oh, delighted, Karen. Well, one of the first ways to answer it is first to really, truly acknowledge the anxiety. And even if not the anxiety, in some ways, perhaps the weariness. It has been a year now. And yes, as we were coming to the the dropping of the ball in Times Square on New Year's Eve, people were saying, "Oh, good riddance to 2020." All those memes. I still remember the Back to the Future meme with Doc showing Marty McFly saying, "Whatever you do, don't put it on this year." All the jokes we made about 2020, and suddenly we were in 2021. It was going to be fresh. It was going to be new. We were going to find the new normal. And then nothing. Because there is light at the end of the tunnel, but let's face it, it seems like the tunnel is just a lot longer than we thought it would be. In fact, I remember even last spring hearing people talking about resuming travel in the fall of 20. It just seems to have now slogged on. So I think the first thing to note before we talk about hope is to talk about acknowledging that this is a time that is truly tiring, emotionally wearing. And I think that can contribute to anxiety, can contribute to many things. Mark, Dr. Boom, I think you could say something to that from your end. But I do think it is important to note it also affects us spiritually as well. As we have had past crises, we've looked at those crises and been able to respond by gathering together in places of worship, going to our faith communities where we know each other and are known, hugging, exchanging the peace, receiving communion, all these things that we haven't been able to do, or at least not in the same way. And I think that we have come through 2020 in some heroic measures. I think we have done extraordinary work, but there is no question that this certainly would take a toll on all of us. And so first and foremost, I just want to acknowledge to all of you who are watching, all of my fellow pilgrims in this, I don't know about you, but yeah, I get a bit tired at times and keep saying, well, when will we see whatever the new normal will be? In the midst of that, what has been very, very hopeful has been watching how we have responded time and time again with each other. We have found ways to turn Zoom fatigue instead into a reminder that any connection may not be touch, but we can find a way to reach out as much as possible. I have found that in many cases, there has been a new gentleness in some folks. I've seen folks respond to one another with some gentleness and care that has been extraordinary to see. And later on, I would absolutely love to be able to talk about resources and tools and how do we move forward with those. But right now, I just want to say, I think that part of my hope is coming from the fact that I've seen us persevere. In essence, much like the Israelites of the Hebrew Scriptures, I'm just grateful this is not a 40-year trek, but I can't help but think of those passages and think about how we have experienced some of that. A long Lent, a long passage, but in it, we have found ways to be there for each other in as much as we can and as much as we can. And for that, I think I take hope from that pastoral mutual care that I've seen.
Thank you, Chuck. Wise indeed. It's the longest Lent of our lives, I think, at this point. So,
can
Mark?
can I give up COVID for Lent? Would that be okay? But
you have to get in line. I hate to tell you. Yeah, absolutely.
Yeah, so. Thank you, Chuck, and that's so inspiring. And let me tell you kind of some lenses I look at this through. I am a primary care physician, so I still practice a little bit. I still care for patients. Of course, I run a hospital system, that is 26,000 employees. It's the fourth largest employer in the greater Houston area. We've cared for next couple of days. We're right at our 1-year anniversary. Thankfully, we didn't quite hit it, but we'll have our probably 15,000th patient admitted to one of our hospitals in the next few days. If you'd told me that 13 months ago, I would have looked at you like you had 3 heads, even though we were preparing and knew this could be bad. None of us thought it could be this bad. And so, I come at it in a lens where I have the privilege as a primary care physician oftentimes of closing a door with a person who's in need, much as, so many of you do as in the ministry, and tending to those physical and spiritual and emotional needs. I also have the privilege of helping lead 26,000 people who have been the warriors of this fight, right? I mean, who have, and when you start thinking about hope, but you also start thinking about anxiety and other things, the fatigue, the frustration, the challenge of being a frontline individual at times this year, watching people die, working with families and helping them through that, oftentimes virtually, which is, I guess, surprisingly better than we thought it would be, but horrible compared to being able to be there in person and in touch and holding someone's hand and all the, and loving them and speaking to them and, all those things. That has been immensely difficult. And yet they would watch at the same time dialogue in the community and strife in the community and argument in the community about what's right. And that's made it particularly challenging. So there's no question in the healthcare field of the healthcare professionals alone, there's much anxiety, there's much fatigue and exhaustion and, oh no, not again, kinds of things. And frankly, we know we're already seeing it and we will continue to see PTSD-like symptoms, if not officially PTSD. So ministering and tending and helping our employees and our physicians and others has been a major part of what we need to do. And I love what Chuck said, part of any treatment of a psychological, psychiatric kinds of issues is first acknowledging them, right? And recognizing that they can happen to any human being at any time. They're not a weakness. They are no different than having hypertension or high cholesterol or other things that are out of our control. And no question, a time like this that is so stressful will exacerbate existing mental illness and create mental illness. There's no question. And as Chuck said, when we've been through many disasters, and unfortunately as hospitals, we often are at the middle of that, whether it's a hurricane or a flood, or I think about 9/11, of course, that we all experienced as a common painful event. What do? We gather, we link arms, we kiss, we hug, we cry. You can't do that during COVID. So we've lost one of our main coping mechanisms, as he said. But after we acknowledge that, I think realistic hope is such a key message. And so unfortunately, I did the same, it was human nature. It's that stupid 2020's done and things are gonna be better on January 1st. And then January 6th, we're all looking at like, how could this happen in our country? And of course we've come to the, grim reality. We had a pretty big surge over the last couple of months, but the light of the tunnel at the end of the tunnel is there. I can tell you, I live, breathe this every second of my life right now. With the vaccine supply that's coming, if everybody goes and gets vaccinated, give us 90 to 120 days and we're going to have, July kind of forward be one heck of a lot better. It's not going to be perfect. Let me be clear. There are things that could derail us along the way. If we loosen up restrictions and all act like we never had this again, it's going to hurt us if people don't get the vaccine or if variants get out of control. But most probability is we're going to be in a much better place. So that message of hope, that message of just hang in there with us for 90 to 120 more days, things will be a lot better. And then we're going to have a lot of work to tend to, the long-term negative effects of COVID, as well as embracing and grabbing many of the long-term, very positive things that will have happened societally in businesses, in social groups and others. There are many silver linings to this as well that I think we can embrace.
Thank you, Mark. That gives me hope. And so I'm excited. Luke, how about your thoughts on the question?
Yeah, thank you both. You really brought to mind a book I read early on in the pandemic by Rebecca Solnit called A Paradise Built in Hell. extraordinary communities that arise in disaster. And this was written several years ago, but it talks about pandemics, the San Francisco earthquake, other disasters, kind of political revolutions, and how sometimes our assumption is that that turns us into kind of a social Darwinian Lord of the Flies society, which maybe we have some tendencies toward, but then also how there are these breakthroughs of incredible community, of neighbors bonding together, of people forming COVID pods, of figuring out how to do childcare, of addressing some of those things. So I think that is both part of the acknowledgement and the hope that you both are talking about. I'm struck by just the particularity of place in all of our experiences, and for us three, certainly really kind of different organizations, and we all have shared realities. So, my heart goes out to all the folks in Texas, especially over the last couple of weeks. I'm in Portland, Oregon, and we had COVID, then we had, something like 250 days of straight protests starting last May, and a real disruption of our downtown core and conflicts, openly in the streets here in Portland. We had a series of wildfires in the fall for anybody on the West Coast, and especially in California and Oregon. So not only, could we not go out and be with people, but that we couldn't even leave our houses for maybe like 5 days because of the air quality. So kind of the typical coping mechanisms of being outside were not there for us. And then we also had some ice storms recently, right? So it's one thing on top of another. I really resonate with the acknowledgement. I think in my role, there are multiple constituents, certainly colleagues and other leaders, faculty who also have children and lives disrupted, but we expect them to continue to do their jobs in certain ways. And then students who are experiencing all kinds of disruption and being able to attend classes, make money, engage challenges with family. So I read just early this year that predictability is the antidote to anxiety, and kind of push that out to our organization, that the more faculty can engage students relationally and be that first point of contact and presence, creating rhythms, putting form to people's days and weeks, really helps to kind of lower that overall anxiety. I think some other common themes that we'll probably thread throughout our questions, acknowledgement, empathy, right? Like I am also experiencing, I have 4 kids at home who are all doing online school, and my wife and I have figured out how to kind of share the load of managing being homeschool teachers as well as being professionals. And so I can relate to all the people who've experienced that, and recently read that that's disproportionately a burden falling to women. And so acknowledging that's seen and recognized and addressing that. On the hope side, I would just add 2 small things. One, I think I posted another resource in our Whova page by Andy Crouch, Beyond the Blizzard. And one of the things he says is that every organization is now a startup. And we have to think of ourselves as startups. We're living in a new world now, and there are a lot of opportunities that can emerge. Obviously, we don't want to be insensitive and leave the grief in mourning. We do need to do that together. But then what does it mean to be a startup? What does it mean to be entrepreneurial? What kinds of opportunities has this new way of being in the world opened up for us? And then the other thing I would say is, especially for leaders, we have kind of just a different mandate to care for ourselves, to biohack, to make sure that we are engaging our bodies, our minds, our spirits, so that we can project hope, right? So that we can bring that energy to the people that we work with and really spread that, because there is an element of contagion also to hope in that way.
Thank you, Luke. That was all just so on the money for me. I love that. The predictability is the antidote to anxiety. I that has never resonated with, that sentence has not resonated with me more than right now, that the more we can give people to plan and predict and sort of hang on to is the way to combat some of that anxiety, for sure. And just being present, knowing who they can rely on, knowing who they can lean on, and knowing who they can call, and that they'll get a response, right? So for everyone, email has quintupled, if not multiplied by 1,000. And so knowing communication resources, and if you're going to give people a way to communicate with you, make sure you monitor and you respond to it so that they aren't talking into the void. Because it's just not as easy to have those organic conversations anymore. You're not passing in the hall. You're not, meeting at the coffee shop or running into each other at the grocery store. Or if you are, you're doing it very quickly and then moving on. So,
yeah, I want to pull a couple threads of some key points just from a medical perspective that y'all said, and then Luke in particular said, structure matters, predictability matters. And one of the challenges during a pandemic, especially during some of the hardest parts, right, is the normal structure went away. Whatever the cadence was of going to work, going to church on the weekends, etc. And one of the mistakes many people made was then to allow structure to go even farther away. I'm not going to shave today. I'm not going to dress today. I'm not going to shower. I'm going to, et cetera, et cetera. Really very important that you maintain and develop and maintain whatever those new rituals are, whatever those new structures are. Very important things. Outdoors, I can't, and that's one of the bright lights of COVID, right? Is outdoors is a really safe place generally. We talk about a nature pill in healthcare. There's a fair amount of data really strongly emerging that says time in nature is very therapeutic. And so for people who do suffer from anything, from mental illness, from preventing mental illness, find ways to spend time in nature, right? The national park, the state park, the hike, the walk through your neighborhood, other things like that are eminently doable no matter what's going on with COVID or whatever else. And seize those moments because those are things that can really help alleviate a lot of stress and anxiety. Work exercise into your routine. That's usually an outdoor activity, and exercise releases endorphins, helps with stress, helps with anxiety, and all of that. There's many things we can do to alleviate this, because we have to acknowledge the reality that the world is not the same world. And it won't probably quite ever be the same world, but it's going to be one heck of a lot better, as I talked about. And I love the leading beyond the blizzard. One thing, every time I talk to Luke, I write down books I need to read, and then I get anxious because I can't find enough time to read them. So I'm gonna have to stop writing down books, but I'm going to read that because it's going to be very exciting.
Yeah, I just to pick up on one of your points, I think, the things that we were leaning on before aren't there anymore. And like you're saying, it becomes even more important to create those new structures. So for example, so many of our faculty had to shift online, and some of them didn't feel that comfortable with the technology in that space. And so maybe defaulted to some things. We had some that did it really well in terms of, here's a structure that I used when we were present together. What can that look like in terms of an actual rhythm of spending an hour together on Zoom to also help create a rhythm and a regularity that has kind of an open and a participation and an information and a processing that's not just let's all hang out on Zoom for an hour, which seems more disruptive than predictable in a lot of ways.
Now, to me, this raises the question of the role of the church. In many ways, I was speaking to a priest, to a rector of a parish in the SEAP network, in fact, just in the past week, who said in this past year, amidst the stress, amidst the pain, amidst everything going on, that he and their team there said, this is the time for us to think both in terms of familiar structures and rhythms, and to think about how to meet fresh challenges in fresh ways as well. And to me, there's no more important time to say, what kind of resources do we need not just for ourselves, but for the church to actually be there beyond ourselves. At our best, the church always is looking beyond ourselves. And during a pandemic, correct me if I'm wrong, good doctor, but it's real easy to focus inward only. And of course, we need to do some self-work. But I always think about my days pre-COVID on the plane and that announcement, that familiar announcement at the beginning, if oxygen is needed, the masks will drop. Put your own on first, then help someone else next to you who may need help. So once we have put on some of our spiritual masks and physical ones, then the question is, now what do we do? What can we do? And one of the things that I have that's resonated with me is the fact that we've been coming through more than one pandemic. We have had, of course, the obvious of COVID, but we also had a year of incredible unrest, of great division, of racialized violence, and of unrest, a cry for justice from those who said this has just exacerbated a problem that has been there for a long time. If I could, I just would like to briefly share some resources from the Episcopal Church.org, the homepage of the Episcopal Church. One of the top ones here says, "From Many One, Conversations Across Differences," which is a way for us in congregations to look at resources that are there for us to understand how can we deal with differences amongst ourselves, red, blue, Republican, Democrat, conservative, liberal, whatever, but also how can we then in turn become places of hope and healing and bridge building beyond ourselves in the society around us. In essence, to be medicine, to be balm, as my boss, the presiding bishop, often says, to be that balm in Gilead for the society around us, which is not easy. And it's not unlike facing the health pandemic. This is going to be hard and long, but how can we take steps? And I've been greatly encouraged to see how some of our places, how many of our congregations have chosen to find resources and figure out fresh ways to address these things, none of which are easy, all of which are crucial.
Absolutely, Chuck. And I actually think that's a really good segue into our next question. So the next question is, how can we, churches and leadership, help to usher people through times of transition? While we are all experiencing a certain degree of loss, what we are actively moving through is a state of transition. Luke, I'd like to call on you first to answer that question for us.
Sure, yeah, I think there are kind of two dimensions that stand out to me. One is just organizationally, and I think about all of our fields. So higher education, certainly the church, certainly healthcare, have been experiencing forms of disruption in different ways for several years. And I think, I know for higher education, technology has been a source of that disruption. And I think in other industries as well, it's helped to sort of complement more recently, but it's been this ongoing process of helping usher people through times of transition. And so, you know, I think like adaptive leadership, HIFITs and others really help. But I know one of the things that we wanted to bring into the conversation, and Chuck, you brought this up, was politics in our communities, especially in diverse communities, where people are part of our communities and maybe on different sides, especially during the polarization of the last year, maybe the last 4 years that we've seen. And I would say also in what we've seen as an epistemically challenged environment. So an environment where it's been difficult for a vast majority of people to even agree on what's true, right? So we've seen this about the vaccine, we've seen this about masks, we've seen this about the election. And so that's a challenging environment and certainly kind of a death of something in our society. And so how do we move through it? I think some of these things have already been said. And Chuck, what you said in terms of local communities and engaging conversations would be one of those things. But the first thing I would say is we have to prepare for the long haul. I know that in different moments over the last year, I got caught up on Twitter and what was happening that day, the news. I mean, you know, the election day and kind of subsequently, I never watched so much cable news, which I never do. And I could see in myself, it made me become like really focused on the moment to moment and actually increased my anxiety rather than reduced it, right? So I think preparing for the long haul, one of the things about that is, what are our long-term goals? There's more to the world than what we see physically, that we're in a spiritual world, we're spiritual beings. The horizon of reality is more than just what we see and more than the outcome of an election, though it can also have spiritual consequences. And so how do we engage that practically? I think one of the ways is to practice wonder. You know, Mark, you were saying just the role of nature in our lives, practice wonder on a day-to-day basis as we're walking and observing the trees, even the fallen ones here in Oregon as a result of the ice storm and the flowers coming up, and the particularities of the people that we do get to interface with on a day-to-day basis. So preparing for the long haul and practicing wonder versus, you know, getting over focused on the minute-to-minute changes. You know, in the environmental movement and with Earth Day, we had that saying, think locally, act globally, or think globally, act locally. I can't
Correct.
remember.
Both
There you
work.
go.
But
There you
yes.
go.
I think that's really important as well, kind of politically, that, yeah, we should think globally and act locally, that we're engaged as political and spiritual beings when we are seeking the peace and prosperity of our very community, right? And there are ways that that manifests itself that build community rather than tear it apart. So the PTA, your neighborhood, local businesses, ways that we participate as political and spiritual beings, interpreting ourselves, seeing ourselves as engaging kind of a larger civic world by doing those things that impact our neighbors.
So, Luke, I would thank you. Amen to that. Preach it. But I would love to. I just noticed that Chris E. in the chat room wrote, when do we stop emphasizing the difficulty of this time and start really talking about hope? Great question. And I think that you already kind of gave us a way through both what you said and earlier, Mark, what you said. Part of it to me is recognizing in the midst of the difficulty, acknowledging that we are in it, but in that saying, where are we finding the footprints and fingerprints of God right now? In the midst of that, where are we encountering God? And, you know, is it, as you had said, in the midst of that walk outside? And for this, you know, perhaps looking up. I've never looked up as much. When I hear an airplane go by, I never looked up. I just took it for granted the plane's going by. To look up and just take note and as you said, a bit of wonder, a bit of awe and wonder. Where's God possibly in that? Also, to be able to say, where is God in this time in seeing God and seeing the face of Christ in others? What does it mean to find hope? Well, part of it is looking outside ourselves, in my opinion. And so I think taking time now to write a handwritten note to someone. Many of us have experienced deep loss throughout this time. My family is no exception, having lost someone to COVID, my older brother. That was 2 months ago. And this past week, someone in the leadership team of the Episcopal Church wrote me a handwritten note, mailed it to me, put a stamp on it, got that in the mail. I went to my mail just yesterday and found this beautiful handwritten note saying, you know, it's been 2 months and I know that this can really hit you at different points and just wanted you to know you're in my prayers. Where is hope? Hope for me is seeing the face of Christ in the person who wrote that beautiful handwritten note, and also at the same time hope for the future. I think in terms of us as Christians, as followers of the way of love of Jesus, is also saying, and what, God, would you have us to do in preparing for the long haul? What would you have us do now to prepare the way of love in a fresh way in the new normal? Not to simply be passive recipients of whatever the future brings, but for the church to be church and to find a way for us as followers of Jesus to say, Lord, what would you have us do, me personally and us corporately? And what could we start to put forward in our systems, in our structures, in our patterns of being? What could we do that might be a fresh way of preparing the way? In many ways, being John the Baptist, preparing the way for what the Lord will do next as we move forward. So for me, Chris, thank you for that note in the chat room. But in acknowledging this time of difficulty, then the hope comes, in my opinion, from saying, where's God in the midst of it? And where is God calling us to be as we move forth from it?
You know, there's so much to be hopeful for, and there's so many silver linings to even a really difficult year. You know, as I mentioned, we have 26,000 employees. Every month I send a president's letter. And back in November, kind of with the, kind of theme of Thanksgiving coming up and everything else, we wrote about, and I wrote about the silver linings of a pandemic. This is to a bunch of healthcare providers whose lives have been, more disrupted than most. Everybody's been disrupted, but on top of that, they are at the front lines. And the outpouring of beautiful stories I heard of, spending more time with the people that really matter, right? The deep relationships and the depth and the development of those relationships, reconciling with people they love, because, during a difficult time, you kind of look in the mirror and you think about those things. The challenging conversations that we, that really got catalyzed this summer as a community and as a country, as challenging as they are. You can't fix issues if you don't face them. And people looking themselves in the mirror and saying, what role have I played in many of these things that we're talking about? And recognizing we all have, and then saying, okay, we're going to do better. The people who said, I used to drive home for an hour and a quarter in Houston traffic, and now at 5:15, I can be there for my kids at something, because I'm now working from home. I mean, and so lots of things, even in the middle, to be hopeful, but then so much to be hopeful for going forward, because we can hardwire so many of those things that we found meaning in, right? Why is it that during normal times, I don't spend the same depth of time and deep relationships with some of the most important people to me, because we're spending so much time maybe in other things? Well, let's reassess that, reevaluate, do the things that matter the most. How can we put virtual work into play, which it will happen for sure. I think about worship, and I think about how do you reach vulnerable populations, difficult to reach populations. Yes, everybody had been doing some virtual online. Now we all figured out how to do it, how to use it, and the people doing it, whether it's us talking on a Zoom or it's a faith leader doing that for a congregation, whatever faith, we're much better at those. So those will enrich the world. How do you connect to people who can't get out of their homes, et cetera, et cetera. I think there's just so much we've learned. And frankly, we have to commit to taking those learnings and moving forward. I liken it to, something horrible that happened in Houston 20 years ago, which was Tropical Storm Allison, when all of the medical center hospitals here, this is a rich, vibrant medical center, all these different institutions, they flooded. I mean, they were taken out of operation we were out of operation, at some level for a couple of years, but weeks where we were really truly out of operation. We hardwired every change you could possibly hardwire, and Harvey hits with way more water dumping on Houston. Essentially not a drop in any of those institutions. That's hardwiring learnings from a disaster, from a tough time. So we can hardwire all of those, whether it's how to prevent the next pandemic, which we have to do, or whether it's how to take the things we learned to do during a pandemic, virtual medicine, virtual health, caring for people in rural populations, for instance, in my work line, and bringing, urban care and, the super specialists who couldn't possibly live in a town of 10,000, but he or she's there because you can now get them on the internet, and through virtual care, et cetera, et cetera. And I just have so much hope about those things, but we have to be purposeful about them. And leaders like faith leaders, educational leaders, hospital leaders, business leaders have to all work to say, we don't just regress back to the way things were. We say, now, how's it better going forward?
So Mark, that kind of preparation can be something that those who are listening in here who are members of vestries, lay leaders, as well as your clergy, could really think about at your next vestry meeting. And hopefully many of you are already doing this, but to begin to ask the questions, what can we be doing now? What could we begin to be thinking about now? Even if we don't quite know the answers yet, what can we be thinking about intentionally, making time in our vestry meeting to consider so that we are prepared moving forward in many ways? What can we be thinking about now about what worship could look like as we move forward, both going back to the familiar while taking in fresh learnings from what we have done during this time? What do we do about people who have joined us virtually for worship who may never have come through our doors before? What are some ways we can think about reaching out to them? What can we do in terms of being a church of outreach in a fresh way beyond this? So in many ways, the preparedness, I know there's many folks who are talking, thankfully, about pandemic preparedness for the future and taking lessons from now. How can we do this as leaders in our local congregations and dioceses so that we have a way forward, or at least the beginnings of a way forward, by God's grace and by us being intentional about it?
No, I think that's great, Chuck. And just to kind of jump in there, one of the things, especially here at the cathedral, that we try to do is recognize what we as the cathedral and congregation can do well, but then also knowing who else is capable in doing well those things that we can't do, right? So being the community hub in that regard, understanding that it's not all us, it can't be all us, but we can be the place of connectivity. We can help bring the hospital system and the academic system and the church together by understanding and connecting with our community partners in that way, so that when folks come to the church needing help, like we've discovered, technology is a whole new form of pastoral care, whether it's teaching someone how to use it or whether it's providing it to somebody, where it wasn't there before, and a way to communicate. But how can we understand what we're capable of financially, physically, and as a community, but then who else is doing that good work, and let's connect people together. So
absolutely. And for some who don't have great resources, or who have found this past year to be extremely difficult financially and otherwise for them as a congregation, the questions are still there. We do have to put our own mask on. We do have to first get some oxygen and breathe. Yes. But it is still, wherever we are, big parish, small parish, struggling financially parish, to be able to say, Lord, what would you have us to do? And we're going to need your help on this. So we're going to need you to help us figure out how to do that, even if it's connecting with others who are already doing this and pointing the way.
Absolutely. So we've got about just over 15 minutes left. So let's maybe move on to question 3. Churches rely heavily on volunteers to ensure that business continues as usual, no matter what the circumstances. With that perspective in mind, what are some practices or principles from your organization that churches could fold into their management and operation that may help in times of crisis? Mark, I may ask you to lead on this question.
Sure. Well, obviously, we, as a hospital system, we have lots of, we depend on and benefit from lots of volunteers. And unfortunately, we turned off all volunteerism for a while, during COVID, because there was a point where we had to really say, who are we going to put at any risk? But as we learned more about the disease, we brought them back on board. We have seen, volunteers during times of crisis are critically important. I think about our setting, and the things they help us amplify are hard during a pandemic, but I don't want to focus on the pandemic. I want to focus on their role kind of broadly. They're hard, but they help us connect more deeply with people, right? They come in, they have the time because they're there and dedicated at that moment, and they're not getting called by an IV pump or this or that like the nurses. They're there to hold someone's hand. They're there to talk to them. They're there to understand what makes them tick and to connect with them, to assist with functions. I think about a church setting, right? They're the people that help you get into a vulnerable elderly person's home and figure out what would make their life better. You need to figure out how to get them meals. You need to connect them, technology wise, like you talked about. You need to help facilitate a reconciliation or connection with other loved ones and other people they have. So, I think volunteers play an incredibly important role. And kind of to pick up a little bit on what we were just talking about, I think we all have to embrace together as volunteers, as many different aid organizations, and recognize that many things we've talked about this year, COVID, the suffering from COVID, the inequities we've seen as how COVID hit different populations. It's the same thing we're talking about in terms of why are we still having a conversation this summer about, what zip code you're born in predicts, what's going to happen to you during your life and how likely X, Y, or Z is going to happen. Why do we see differences in policing? Why do we see all the different things that we talked about? I mean, we can end this, and kind of looking with a long lens, you'd say, well, we've come a long way over the last 60 years because we have. And so we have to look with a long lens and say, we can be at, a nirvana in the future, but we can't be at nirvana tomorrow. But we certainly can march together, lock arms as volunteers, care for each other, love each other, and, really work together towards those goals. And I think when we link together and show that unity, that's ultimately what volunteerism is about, right? It's loving fellow man, fellow mankind, fellow humankind. And gosh, did we see that in COVID, right? I mean, COVID was the great equalizer. Every single human being on the planet is susceptible to COVID. You can take any characteristic of any human being, they're all susceptible, right? The only susceptibility that changes is age and whether you have some underlying conditions, that may change that from person to person. Yet it was the great unequalizer, right? As in we saw significant inequities in populations that were affected. I think we can link together. We can work together as volunteers, and we can keep each other safe. We can love each other, and we can make the world a better place. That's ultimately what we need to do coming out of a tough time like this. Times of crisis are the, sort of the forge in which we build the future. I've always seen it that way, and I hope we can do that this time as well.
Thank you, Mark. Luke, you want to say something?
Sure, yeah. I didn't necessarily think about this with volunteers in mind, but I think it's really relevant to churches that do rely on volunteers. And one of the things, and I think this really connects with what you're saying, Mark, is keeping people involved and connected. I think the challenge is one of the best solutions is like more Zoom time, which may be like the thing that people don't really want. But I know, we've been really attentive to this in terms of the mental health of faculty and students. And the feedback that we got was really needing connection, and that everybody's in different circumstances in terms of both their personality and their social life situation, but there was a deep desire for connection. And so we created some smaller groups of virtual meetups for faculty. We did that as well for students, for people who wanted to opt into that kind of connection. And then another piece is, if your volunteers, your employees, and their talents, then there have been lots of opportunities of tapping specific people to use their talents in ways that are needed and also help the kind of organization move forward. We got a lot of feedback from employees that said, we need to do less and we need to really focus on our core functions based on all the things that we're trying to absorb. And I think that's been a really helpful practice, is getting that feedback loop of how different people are experiencing their lives and experiencing their work in order to be able to address that. And at the same time, organizationally, we need to keep future-oriented projects in motion and not just let them fall because so many people are working from home and have challenges. And so as leaders, that's been a challenge to say, what are the future-oriented projects that are really strategic, and what does it look like to keep them in motion?
You know, years ago when I was a parish rector, I remember this one parishioner who had spent pretty much all her adult life in that parish, had made such a difference in all kinds of ways, serving in the altar guild, serving as a greeter, in so many ways making a difference, and then found her own life upturned by health issues that ended up leaving her totally homebound. And it was devastating. It was absolutely devastating. And she reached out and said, give me something to do. Don't just please come and bring communion and minister to me, but give me something to do, because that volunteer in her, that was what was, she wanted to access that. And so one of the things she did was a vital ministry was developed that day of sending out cards, handwritten cards to people in the parish, for those in need of pastoral care. Here was someone who was totally homebound herself. On behalf of the clergy and the vestry, was sending out these wonderful cards, and also sending them out to people who came as newcomers. So that newcomers got a call from the rector, but they also were getting this wonderful handwritten card on behalf of the vestry and all the people of the church. I think about what it meant to me this past week to get that handwritten card. I think about ways that we just may take for granted. So even as we make use of the new technology we have, to be able to say that there are so many ways that people can exercise volunteerism, so many ways to be able to live out that way of love. I noticed that Timothy D. earlier wrote, how do we prepare the way? How do we do a fresh way of preparing the way? When I think about pre-COVID, Presiding Bishop Curry talking a lot about the way of love and distilling it into 7 principles: turn, learn, pray, worship, bless, go, rest. Part of it is to say, okay, well, let's take each of those in turn and say, how can we think in a fresh way about each of those? Which goes back to what I said earlier about how can we, as leaders in a congregation, clergy and lay leaders alike, minister to ourselves, allow God just to help us breathe, but then also say, how can we find some good old-fashioned ways and some fresh ways that all of our folks, especially those who have a spirit of wanting to reach out beyond themselves, who have volunteerism in their DNA, we can say, what does it mean to bless in a new way? What does it mean to be a part of learn? What does it mean to go when you can't, but you can send something? What does that mean? And I think in that way, we really can show love in tangible ways, using both new and good old-fashioned old school methods as well, and tapping into that sense of volunteerism, which really is in a lot of our people's DNA.
Thanks, Chuck. I love the idea of maybe I can't go, but I can sure send, right? Like, I just love that idea. I think that's going to be my takeaway. Not that there's going to be many takeaways, but that's going to be my takeaway. How I can't necessarily go, but how can I send? We've got just a few minutes left, about 7 minutes until the 30-minute mark of the hour. Chuck, you had mentioned wanting to bring back up the vaccine conversation. I know that's something that's on everybody's mind, and especially having Dr. Boom with us. Chuck, how would you want to revisit that point?
It's simply to remind people the importance of what Mark said, what Dr. Boom said about this, and to know. And I showed this very briefly earlier when I was talking about from many one. But if I go back to the homepage of the Episcopal Church .org, you'll see a section here that says Episcopal Church Toolkit for COVID-19 vaccine distribution. That page has so many resources for what congregations can do to help. Because of course, as we know, we're looking towards what is affectionately called that herd immunity. I love that term, but let's face it, we are, the the sheep of Christ? How can we help our fellow sheep? How can we all find a way to get that out there so that people are able to make use of that and to feel comfortable using it? I understand that there's some fears out there for some. How can we help address that? The beauty is the resources in that section speak to all of that, to the fears, to the practical ways to do it. It is an excellent resource, and again, it's found at episcopalchurch.org. So I just wanted to commend that and other resources to helping us take seriously what this means. Bishop Michael, a year ago, when this all first started, Bishop Michael Curry, on news programs, when he was on Today's Show or Good Morning America, whatever, would always end the program each time by taking out his mask and saying, "You want to know what the way of love looks like? Right now, right here, this is part of the way of love." In the same way, I think if we could find a way for our congregations to help people see that with the vaccines, that would be a very tangible form of outreach to the communities around us.
Absolutely.
I love, I mean, I couldn't agree more with, the mask. And my mask now says vaccines save lives on it. So it is, it is the mask save lives. Now it's the vaccines. And you want to show love for fellow human beings, get vaccinated, right? There is almost no one on the planet who cannot safely be vaccinated. It's the ultimate societal sort of community activity, right? Where we love each other and where what we do will benefit us, but it benefits everybody else. And when we collectively do that together, we can move in every way, shape, and form onto something that is so much more powerful and so much more, beneficial for all of us, and tackle problems other than COVID, which we'd all like to do for sure. And I'm quite certain we can get there. In fact, I believe we can get there in 90 to 120 days based on what we see coming out of the federal government. But it requires all of us to say, when it's my turn, I'm getting vaccinated. I'm doing this for love of myself. I'm doing this for love of my family, and I'm doing this for love of my community, country, and ultimately all of humankind. Faith leaders, faith institutions play a remarkably important role in doing that across all communities. So thank you for helping with that.
Thank you, Mark. All right, we've got 3 minutes left. If there's anything that, first I just want to thank you gentlemen for being with us today. What a robust and wonderful conversation. And I'm so grateful to be a part of it and to have you give up your time to be with us. If there's any parting words that you'd like to jump in, anything you didn't get to say, please feel free to do so before we wrap up. We've got just 3 minutes, so 30 seconds.
Luke, you want to start us off?
I think we've covered a lot of it, and we could probably go for another hour. I'll mention one more book that's been influential. It's called The New Leadership Literacies. It's a few years old by a guy named Bob Johansen, who works for the Institute for the Future. And one of the things that he says is that we need to look back from the future, but act now. So thinking about where we want to be in the future, and to act on that now, even though we know we can have some clarity in the present, but not certainty. And I think COVID has exposed that. This past year has exposed that. And it's also exposed, inequalities, financial vulnerabilities, all kinds of things in all kinds of industries and organizations that need addressing, and could maybe help us think about the future, which I also think helps breed hope even better.
Thank you, Luke. Mark, any closing words?
Yeah, I'll go back a little medical, because the hope is there in the short term. It really is. And it's the answer is the vaccines. And we can move on and then look with a lens that says, how do we look back at the United States and our institutions, our faith institutions, whatever, our families, and say 10 years from now that, we came through this and we came through it stronger. We learned the lessons, we hardwired the changes, and the world's a better place because of 2020, as hard as 2020 was. I mean, on the bright end, I'd rather be going through this pandemic than the pandemic in 1919 that my institution was founded during, when, you couldn't basically do anything for the people who were sick. Now we've saved so many people. And the things we've learned that we will apply to other medicine will be huge as well. So how do we all hardwire those learnings and truly have a better world, a better place, a better institution, a better family, et cetera? I think we can do that. And that's when we think that way and we think about what we learned and we think about the longer term view, the short-term problems, they fall by the wayside, right? I mean, at the end of the day, they're not big. It was kind of that comment Luke made early on about too much time watching cable news. You all just hear the problem of 2 minutes ago and somebody's opinion about that. Tune that stuff out, take the long view, and we can make the world a better place for sure.
Thanks, Mark. Chuck, any final words?
Absolutely. You are not alone. We are not alone. God is with us in the midst of this. Those are not empty words. That gives me hope. But also, God is with the rest of the community around us through us. And so my hope is we will also take this seriously and say, how can we be even more of people who show the way of love of Jesus to those around us in practical, tangible ways with our actions and, yes, with our words, so that they too know that they are not alone. Also, I just want to say a huge thank you to you, Karen, to Angela, to Adam, to so many who were a part of this, to Joe Swimmer and the SEAP Network team, and especially, I think, to all of you all who took time today and thought this would be worthwhile to use your time to listen. My prayer for you is that hopefully there will be some takeaways that you can make use of as you go forth.
Great. Thank you, Chuck. Thank you, gentlemen, for being with us today. Thank you, everyone who joined us on the workshop. I hope you enjoy the rest of the gathering and that you've enjoyed your time so far. And it's just great to have everybody together in whatever way we can. So
Thank you. It was delightful.
Bye, friends.